All right, here we are. It is 2
You
o'clock.
checked all the buttons, all the linkies. All right. Hello again. Good morning to our 0 to 1 loyal followers. Oh, you gotta move on. You move over. Yeah, sorry. Not good at the mirror image, clearly.
Yeah, so just like everyone to know that we booked this morning show, and most everyone showed up.
Wow.
And Lisa booked this afternoon.
Wow.
And all you got was me. Sorry.
Oh, yeah, Joy.
Fine.
We did. We've been doing some things. We've been eating a lot of food.
Yes.
We're gonna talk about this Phillips report. We were invited to their press thing. It was great. There's a lot of stuff in there, and we may or may not have other people show up. But but Joy, if those of you who follow along, this is Joy Rios. She runs the Hit Like a Girl media empire, and she has been on like a road show, a European road show, ahead of Health Europe. So she's gonna like tell us what she thinks.
Yeah, just decided to take the community global and like have bigger conversations. We've done it. I've done it around the U.S. a few times, which has been great. And I was like, you know what? Let's have bigger conversations. So it's been really nice. I had an opportunity to experience jet lag in Paris. I recommend that to everybody. Yeah,
Lovely.
Seems nice.
yeah. I was like, oh, it's a big jump over the pedal, so might as well just be tired in a beautiful place.
I'm experiencing no jet lag, famous last word.
Yeah, experiencing a lot of things. Yeah. And it's all the drinking doesn't help. Or it does.
Yes, who knows?
You know,
Could say.
I'm not tired after a few drinks.
Yes. So got to do a little bit, just a very small meetup in Paris with some folks that are local there and with some of the people that ended up coming here to Health Europe. And honestly, we're like, oh, let's take selfies and do TikToks and just like have an opportunity to connect, which was great. But then hopped over to Slovenia, which glad that got on my radar because what a beautiful country. And not just that, but it was like there was a meetup that we had a conversation around women's health. So there was a nice, just like focused group of about 50 people that brought different organizations together to get collaboration just among that local community. And I kind of love being able to be the like spark for that. I'm like, I'm here. Time for you guys all to collaborate. Which is a little silly.
But it looked like a pretty good crowd.
Yeah, it was.
Yeah,
it was fantastic. And then the following day, we went over to Lake Bled, which is beautiful, like the only lake in Slovenia,
right?
with a castle up at the top. Obviously. And there was a healthcare leadership summit, which brought in like ministers of health from all over the place. And so it was great to have conversations around like bringing digital health to Switzerland and Portugal and how we address things in Africa and Latin America. And so, yeah, it's been fascinating. And you know what's interesting? The networking. I thought that I would be doing all the networking was in Slovene, that their language, but then everything transitions into English when they do the programming. And so everybody's like bilingual and trilingual, and you just like talk about like, you know, being in a room full of people smarter than you. Like,
I mean, I feel like that's like most of my days.
Yeah, it's very humbling, and I'm just like, oh my god, I'm so grateful to be here, to be honest, and learned quite a bit. So yeah, it was great.
Cool. So like, what's the biggest what's the biggest difference, and like what's the thing that stood out in general?
So there was a passionate speaker, Dr. Roberto, and I will butcher his last name, but he was the gentleman from Portugal, and he just like was captivating. And I honestly recorded the 17 minutes, like every word of it. I was like, I want to know about what he's talking about, and his perspective had to do with incentives and how do we drive change, but specifically, and but what's like my takeaway was what he was saying was happening in Latin America and Africa, where they do a lot of building of infrastructure and they're like buildings, etc., but not necessarily investing in digital health or having the right workforce to be able to work in those buildings.
Yeah.
And so imagine you're building like all of these cities, essentially medical facilities, and then not being able to fill them with people that get like enough staff. Right.
Wild, yeah.
And when you think about like, oh, because they understand the concept of like, oh, building equals jobs, constructions, you like get that, but like, okay, let's move on to that. How can we actually support the communities? Right. And so, yeah, that made me noodle quite a bit. I like had my wheels turning. Yeah.
Yeah. Well, we have heard a lot of like about building brick and mortar. Like that's been like a theme where we're like I don't really feel like we do a lot of that in the US. Like, we got a lot of stuff.
We've got plenty of buildings. Yeah.
Like at least that's not the conversation I usually. Maybe it's just I just don't have it. But yeah, like here it's like everybody's talking about we're still building new things. We're still building new things.
Well, and it seems like there's still it's at the beginning stages of digital. And so interesting just to see how they're handling all of it.
Yeah.
And it's just different. It's just very, very different.
It's just different.
Yeah.
Yeah, we had a hallway conversation with an American panelist who was on a value-based care panel. Pinch hit, someone's plane didn't make it, and so like he showed up, and like U.S. value-based care expert. He told us it does not mean the same thing here.
No, not at all. And that's what this guy Roberta was bringing up, was just incentives. And he was talking about like, how do we incentivize people to really work with the community and teach, like, in education, and like have those being the values that we want to bring.
Mhm.
And anyway, it was really
Value.
Exactly.
The U.S. is like value equals money.
Wait a second.
They're like, maybe it equals actually good care. Weird.
Right.
Weird.
Yeah.
Yeah, and so we talked about this on our morning show too, Joy. But yesterday we went to this Fin Partners and Galen Growth thing, and they had the Galen Growth people had some really cool investment numbers and just talking about like where the money goes. They were saying like in the U.S., basically all the U.S. investment stays in the U.S. for healthcare, and then the other countries were like Europe. About half of the investment still goes to the U.S. Like people are just investing and I think it was pretty much across the board. I think the Middle East was a little bit more diverse, like had mixed things up a little bit, but overall, it's like most of the money comes there to the U.S.
Yeah.
Which is super interesting and like kind of a bummer too. So most of the questions in that session were European startups asking, how do we get into the U.S., which is like objectively kind of a bummer because then you're like in the money rat race.
Well, yeah.
Whereas like as the printing press, we're just
the unlimited printing press of money.
Well, and we have a hard enough time understanding our own system. Yeah. Imagine coming from the outside and being like, okay, try to keep up with regulations.
Right. Not ideal.
Not ideal.
Not the best. And then there's been like a lot of AI. We have like about half of our guests have been excited about AI. The other ones are just like, I think Ben Zaniello gave us tips on how to avoid the AI sessions.
How to avoid AI.
Was it him?
Yeah, he was like, don't go.
He's like, this is what you got to do.
Don't go to them.
So yeah. What do you think? What do you think about the AI?
I mean, I think as far as leveraging our own productivity and using it in a really smart way, yes. But I do think it's the solution to everything. Absolutely not. I'm like, I don't think it's man versus machine. I'm like man with machine.
Yeah. Yeah, and who was the AMA? Jesse
Ehrenfeld, the former president of the AMA.
Oh, he's former now.
He's now former. Yes, he's now former. They do it every year. They're new.
He's immediate.
He's the immediate past president.
Yeah, he told.
Shout out to Jesse.
And we couldn't screw. We really tried.
We tried so hard to mess him up. He was on it. So clean. He was like. They did some media. The AMA does some media training for their leadership, which is great. Good job. He was a square.
So what did you try to trick him with?
Well, we just tried to push him on the AI stuff generally, and he just had great, like really solid answers. And I think I don't want to speak. I'm not speaking for the AMA, please, but I would just say, that rightfully they're saying, we need to have physicians at the core of this. I think one of the things I keep hearing, which I'm getting really concerned about, is the suggested proliferation of these tools that are going to exploit human weaknesses, which we were talking about, information bias, right? If you see it in the computer, then you think the computer must be right, and it's like, nah, that's not. And then they're saying like, well, but it's going to be checked by a physician. It's like,
no, it's not.
Physicians are human beings. And like once you have that, you're like, it's fine. Like the machine told me.
But just think about the quantity of data and like trying to get to it all. Yeah, it's literally humanly impossible.
It is. Yeah. That was part of the Phillips report.
Yeah. So should we go through that?
Sure. Yeah.
I want to hear it.
Hang out. Yeah. Okay. Comment on the Phillips report with us.
We are missing the medium, so they're.
We're gonna show you.
This is like a pretty meaty report.
Yeah.
So they went through the cool speakers, but so the first one was about like data integration in general. Do you remember what these numbers say? Because I cannot move this laptop over.
Yeah, no, I think they were just really giving different types of data that are available to. This is a global survey, so they did a survey of primarily, I think, hospital leaders in like tons of countries, and what they find, unsurprisingly, is the idea that healthcare is awash in data and has very little information or insights. And they were just talking about all the different kinds of data that are available and the proliferation of that and the problem that all these systems are having, being like, well, what do I do with it? And from my experience, and if you watch the show, you've heard me rant about this for a while, like you have to invest really deeply in workflow and care operations to truly understand how and when and where and why to use all of these data that you have. And you also, even though you have a lot of different kinds of data, you don't have good, clear linkages or really rich, robust, multivariate data sets or complete data sets for different sets of patients. Like you just don't, because we have so many structural issues in health. So that was one of their points, basically.
Yeah. And then hold on.
Clicking the button, missing Melissa.
They have a lot about AI, and most of the session that they walked us through was about AI in general adoption, how it's being used. Obviously, this is our favorite topic in the entire world. Everybody knows that. So, but what was interesting in this chart, if you can like sort of see it, you'll see that the U.S. actually has the lowest planned investment in AI.
Really?
Yeah, 56% planned investment. Poland is 58. Yeah, that's the closest. But like the here we have a fan coming to see us. But yeah, the US is overall the lowest. Yeah. So which is interesting. And then like Asia Pac is pretty high. But like I also wonder like what is AI?
I wonder what the theory of the investment is, right? Is it truly that there is a strong theory around cost savings? Mm-hmm. Because if you were which I don't think there is, but like, let's just pretend that was what it is. If you were a country with a very fixed global budget healthcare, you'd be like, well, what can I do to actually save money? I don't think that's what I don't think that that's actually what is truly being like honestly pitched, but I don't know, So that's the AI stuff was interesting but concerning. I always want to just be like, what do you mean exactly? And what do you mean exactly?
Yeah.
And tell me exactly how that. Yeah. Be more specific. How is that actually going to work?
I could have done that, but I was pretty tired by the end there.
I didn't feel. We're again. Remember, everyone, we are not real journalists, so
media.
It would just be me harassing them, which is pretty great.
Bad. All these like real journalists like
yeah, we're like we're not real journalists.
But I like that you guys are just like, I'm going to push your buttons. I'm here to push your buttons.
I don't know that those lovely medical doctor professors were ready for the talk show.
I don't think they knew who we were.
I don't think they're ready for the talk show situation.
What said that they had during the thing was 87% of professionals are actually super nervous about the data that's being used for AI. That there's going to be bias and blah blah blah, which there is. Like, I wonder who those other 13%.
So it was like in spite of like massively increased investments already and planned investments, most medical professionals are concerned about data problems, which is like, are we just walking off a cliff?
Well, I think that if you guys know this conversation, we're exacerbating the same problems, right? You're just like, okay, so now we can make the same mistakes faster and on a larger scale.
In a more automated way.
In an automated,
it's
kind of perfect. Yeah. Well, a legal friend of the show, Tom Novak, always says on panels that like it's actually like what data is being used for underserved populations, right? Because many of them don't have links, especially undocumented populations and all that. So shout out to Tom, you're still here with us. Yeah. But yeah, it's rough. So I'm wondering who's the 13% like what the hell they're smoking.
They're not afraid. I mean, I have no fear.
100% afraid.
Yeah, I'm afraid. We are afraid. Good. That's good. Nice. Was there? And then there were a couple other things in the report itself, which I think Kat has linked.
Will eventually link.
She will link. There was a big discussion about sustainability, and this was actually really sad. They were like, everybody knows this is a huge problem and that healthcare is a massive CO2 emitter, huge problems, and yet we don't have any money to do anything about it. That was the answer.
Baloney. We do have money to do it. And I was having this conversation today, actually, and thinking about we should be having more sustainability conversations, environmental impact. And I think that it's going to affect us in ways that we don't even realize. Yes, not necessarily waste and plastics and recycling, but turbulence and the hotter
Oh, yeah.
temperatures, of just like the ability to, like, and also storms. You're just like, so you're planning an event. Good luck. Anybody getting there?
Forget it.
Forget it. I think
Well,
that,
I mean, I think the point they were making was, you know, these health systems themselves with their specific budgets don't have, they say they don't have any budget to do the thing that is going to reduce CO2 emissions.
but I don't know if they've been really specific about what it is
Right.
they're tracking. And like, what are we measuring and how have we identified?
Right.
If we start measuring, I'm pretty confident we'd be able to make improvements. But I don't even think that we're even comprehensively reporting.
Few climate experts in the show said something like healthcare is it the number one or the number two?
It's real.
Yeah, it's a lot.
The fact that it's a missing conversation. It's not something that we talk about on a regular basis at these conferences. And to be honest, the impact that we are making, like, that's shameful, to be honest.
Yeah, it's pretty wild. It's pretty wild. But yeah, I think like
the results in the survey about this were very sad.
Yeah,
they were not. They were.
Page we're going to because
I don't remember. 17, 18. It's in the report. The report's available for you.
Yeah.
It's interesting. So that's just a bit of a global view.
The speakers, what did she say? She said, clearly wasn't paying attention at this point, but they were like, how are you addressing, environmental?
She said, they said, how are you addressing it? And she said, oh, well, our health system is asking us to do a bunch of small things, including taking the train to conferences. And I was like, I don't know. I mean, I agree, but I don't know that that's going to be the thing that's going to kick us over the edge there.
I think it's going to be a million little things.
Might not be.
It's not going to be one big thing. It's going to be a million little things. And even here, where we got like reusable coffee cups, right?
Also super cute. Everyone should like see the quote. What does it say? Be a friend, return at the end.
That's pretty good.
So cute. So yeah, I don't know. I did haul ass over here on an aeroplane. So
yeah. None of us are poster children.
Sustainability.
But there's the conversation of like, do you want to be in part of conversations that matter? And sometimes you have to be there in person in order. You can't do everything from behind our desk remotely.
Yes.
Well, yeah. I do in person a lot.
You are. Oh my goodness.
Both expensive dollars and also I'm sure I'm killing a lot of seagulls. Like definitely
not. So bird strikes.
I'm a bird strikes, but I feel like I'm also maybe saving America.
We'll see.
All right. Okay. Well, we screwed up our time, so we might be back.
Yeah. So loyal 0 to 1 fans, keep an eye on our various channels. We might be back after some sketch. We might not, and that's okay as well. I'll be here tomorrow and updating LinkedIn with any other exciting findings. Might do some ad hoc reporting. You never know. I'm gonna be a real journalist tomorrow, and I'll let you all know when I find out. In particular, there's going to be some discussions on the European health data space, which I have kind of been calling Europe's TEFCA. We'll see how that goes. I will certainly update all of you with what I hear and learn about the health data space.
What are you going to ask about European TEFCA?
Oh man, I have so many questions about the governance, how it's actually working, how they actually make all of the member states who don't really care what the European Union says do what they want them to do, how they actually guarantee interoperability. Yeah, a little bit. The federal government has a little bit more control over what the states do because they put a lot of money behind it. The EU does as well, but it's not quite the same. So it'll be interesting. I'm looking forward to it. Follow for more data space stuff. Like and follow.
Thank you, Joy.
Yeah.
Thanks.